This week's class, When Your Health Matters, the class designed to empower you to better health through knowledge and education. And I'm your host, Dr. Richard Huntoon from Advanced Alternative Medicine Center. We're located at 138 Canal Street in Pooler Park, that is in Pooler, Georgia. We're in Suite 404 of Building 400. If you wanted to stop in to meet me, that would be wonderful. People are still coming out of the COVID haze, I guess you could call it. Not purple haze, but COVID haze. So people are still a little reticent to meet new people and strangers and not knowing what person's vaccine status is. I've been seeing people throughout the whole pandemic, and I'm happy to see you if you have a health concern. But if you're still a little reticent, you can always call me directly at area code 845-561-2225. Again, 845-561-2225. That is my cell phone. Please do not text that phone, as that phone is not equipped to receive texts. But if you'd like to text me, you can email me. Essentially do the same thing at docrick, D-O-C-R-I-C-K, at spineboy.com. Docrick at spineboy.com. Cell phone 845-561-2225, or stop in at 138 Canal Street, Suite 404 of Building 400. Either way, it's my intention to help you to better understanding what the concerns that you have regarding your health. This class is an important class. It's going to help to address some of the issues that people have with blood pressure. We've done a class recently specifically about blood pressure, how to take your blood pressure properly, and what your blood pressure numbers mean, etc. Feel free to go back and refer to that video at another time. But for this one, we want to talk about the importance of understanding vitamin G. Vitamin G, that's right, I said G as in goat. It's actually part of the vitamin B complex, but it's a part of the B complex that most people don't even know about, never heard of, and wouldn't necessarily understand. So that's the purpose of this class, to give you some understanding. I'm going to read some information that's hopefully going to help answer the questions of vitamin G and how it came about, or the understandings came about, and potentially why it went away as far as literature goes, and as far as doctors' understanding about vitamin G. It was first presented in the July issue of Vitamin News, Volume 2, Issue Number 7, entitled Vitamin G, as it appeared in 1934. 1934, that means this has been around longer than my dad has been around, which that's quite a feat unto itself. It was reprinted as part of the Royal Lee Library series, published in the International Foundation for Nutrition and Health. Please consider the information and appreciate that it was written way back in 1934, and I truly hope that you enjoy the information that I'm going to share with you. In the early investigations of vitamin B, known as the anti-neuretic vitamin, meaning if you have any level of neuropathy, you're going to need some B vitamins. If you have neuropathy in your heart and get irregular heartbeats, you're going to need some B vitamins. It was soon found out that it contained a separate factor that was necessary to growth and was more resistant to heat than the regular B factors, and occurred associated with B in varying proportions, being relatively high in yeast and very low in corn. Different animal species were found to have varying requirements of the two components. They studied pigeons being relatively immune to deficiencies of the growth factor itself, while rats were susceptible to being having deficiencies in either the vitamin B component or the vitamin G component. The vitamin G component is, for lack of a better way to phrase it, it's like the alcohol portion associated with B vitamins. And if you ferment B vitamins, you turn them into alcohol. So the apparent functions associated with vitamin G is necessary for growth and development. It's necessary for cell respiration, meaning your cell's ability to utilize oxygen. Seems important. As a growth stimulus, it promotes normal repair processes and thereby delays senility, or Alzheimer's or dementia. So vitamin G would be important for those who aren't interested in experiencing that. It's necessary in blood regeneration, and most important, and the purpose of this particular class is it helps to lower your blood pressure naturally. Naturally. Lower it naturally. Means without the need for medication. So possible results of deficiency: underdevelopment and retarded growth from malnutrition, eye disorders like conjunctivitis, abnormally slow regeneration and of the erythrocytes, meaning secondary anemia, cutaneous changes within your skin. We talk about pellagra or mild dermatitis, things that appear like plaquing on your skin, etc. They may call it psoriasis or eczema, usually associated with a vitamin G deficiency. Nerve lesions and irritability, known as neuritis. So things like sciatica, any kind of neuropathy, vitamin G could be beneficial. In a loss of hair, people with alopecia would benefit from checking to see if they have a vitamin G deficiency. Interferes with normal skin respiration. Inside of the gastrointestinal tract or your alimentary tract, any kind of disorders like gastroenteritis, stomach inflammation, digestive disturbances, colitis, ulcerative colitis, irritable bowel, any of those kinds of conditions, particularly associated with a vitamin G deficiency. Fatty infiltration and degeneration of the liver is associated with a vitamin G deficiency. And renal manifestations like cystitis, hemorrhagic conditions related to the urine, having stones or what are called renal calculi, and last but not least, elevated blood pressure. Anybody that has elevated blood pressure, I promise you, you're going to have a vitamin G deficiency. So the results of an absence of vitamin G is gastrointestinal disturbances, the ulcerative colitis, diarrhea, nausea, vomiting, not having enough stomach acid, known as achlorohydria, difficulty with growth or cessation of growth, eye disorders, severe conjunctivitis, cataracts, ophthalmia, keratinization of the eyes themselves. We mentioned before pellagra, which is a skin imbalance, severe nerve and spinal degeneration, leading to potentially mental disorders and hyperirritability. Think about your children with attention deficit disorder or who are being told they're hyperactive. And last but not least, the last of the things that happen as a result of vitamin G deficiency would be death. And so we certainly don't want that for you. What are your sources of vitamin G? Well, you can get your vitamin G with natural sources of vitamin B, which include eggs, fish, meat, poultry, bananas, green vegetables, whole grains, and something that I personally don't like, which is mushrooms. Be sure to make them from natural sources. If you're going to use whole grains, not the refined and completely crap ones that are enriched with vitamins. The fact that they've been enriched indicates that they've been depleted from their natural vitamins and have man-made artificial ones put back in. Unfortunately, they will not have any of the true vitamins in its whole form. And so if they've refined the grain, they've destroyed all the B vitamins, then you're definitely not going to get any vitamin G associated with that. So, but eggs, fish, meat, poultry, bananas, green vegetables, whole grains, and mushrooms, those are good sources. Now, if you have a vitamin G deficiency, the supplement company that I deal with actually manufactures, the only company that I know that manufactures whole food vitamin G, because they have an ability to separate out the G portion from the B complex, giving you a tool. Vitamin G helps with vasodilation. In other words, your blood vessels relaxing. And if your blood vessels relax, then your blood pressure should come down. instead of stimulating it with a medication to force your blood vessels to do that. So vitamin G does that naturally. Vitamin B, which we have learned in previous months, I think way back in February, we talked about it has a vasoconstriction. Basically causes the blood vessels to tighten up. So if vitamin G in proper ratios help the blood vessels to relax, then that can help to naturally reduce your blood pressure. There aren't any complications to taking vitamin G because your body will excrete what it doesn't need, but it's not going to have any complications like the medication does. So as you can see, vitamin G is quite important, and we want you to appreciate that. So if you have any questions regarding having a vitamin G deficiency, the offer that we have during the month of July is to have you come in, and we will evaluate you for a vitamin G deficiency. We will check your blood pressure. We'll do it in 3 positions. We'll get a sense of, are your adrenals deficient, causing a dumping syndrome? And we'll just make sure that you have enough vitamin G to help regulate your blood pressure in a natural fashion. And, you know, we want you to have your B vitamins so that you can absorb your foods and make your heart have a normal rhythm, but we also want you to make sure that you have vitamin G to help keep the increased pressure within the system from overwhelming the heart and creating heart disease and heart attacks. So that's it for the information specifically related to vitamin G. I hope that this has been helpful. If you have any questions, please feel free to stop into the office at 138 Canal Street in Pooler Park. We're in Suite 404 of Building 400. You can call me directly at area code 845-561-2225. Again, 845-561-2225. That is my cell phone. I'll be the one answering the phone. If I don't answer, please leave a message. Please do not text that phone as it is not equipped to receive texts, but you can email me directly at docrick, DOCRICK, at spineboard.com. I appreciate you tuning in. Please tune back in next week, same health time, same health station. This is Dr. Richard Huntoon from Advanced Alternative Medicine Center saying, I look forward to speaking with you when your health matters.